Hello, I'm Eric Skindred with the Hospital Association of Southern California. Today we're visiting with Mimi Roberson, a former healthcare attorney and hospital CEO who today is Chief Operating Officer at Well Advised. Well Advised is a free online tool that helps all patients sign up for the Medicare coverage that's best for them, whether enrolling for the first time or evaluating their coverage on a yearly basis. Well Advised is HASC's newest endorsed business partner. It helps hospitals and healthcare organizations maximize reimbursement, and it helps consumers who are usually a bit overwhelmed when confronted with the complicated enrollment process. First of all, welcome, Mimi. It's great to have you here today.
It's great to be here. I really appreciate the opportunity.
Okay, so first question. Tell us about Well Advised and how it works, and how it helps patients navigate through what can be a confusing and disorienting process.
Well, Eric, I think Well Advised is a game changer for the Medicare enrollment process and the difficult decisions which need to be evaluated. Research data shows that 94% of people who first enroll in Medicare enroll in the wrong plan for them, and then 87% of people never change plans. I think this was astounding, and this was a problem that needed to be fixed. So Well Advised, in simple terms, is a complex artificial intelligence engine. We load every single Medicare option in every region, whether traditional Medicare, Medicare Advantage, Medigap, and pharmacy plans, into our system. And then every single payer in the region is loaded into the system. And then we upload every single healthcare provider, physician, and hospital into the system. We then load financial information into the system. It's very complex information, which is then made very easy. Patients and consumers go online to our easy-to-use recommendation tool. They answer a quick series of intentional questions focused on their personal, clinical, and financial preferences. Our system then seamlessly guides the patient in identifying the one single best option for Medicare coverage specific to that individual's needs. It cuts out all of the noise. It cuts out all of the pain. And most importantly, the information is blinded to assure that there is no bias in the decision-making process. And should that consumer or patient or individual want to proceed to enrollment, they simply go through a firewall to find out all of the required documents are pre-populated with all of their information, and all they need to do is provide an electronic signature. Pretty easy.
Mimi, you worked as a hospital CEO in Denver and Louisiana. What do hospitals like about Well Advised, and why hasn't something like this been introduced a decade or two ago?
Well, Eric, that's kind of two questions. Let me take the first one. So hospitals love that they can advocate for their patients and assure optimal patient access. Too often, patients make decisions on Medicare choices based on what other people have, or their neighbors have, or their friends have, not based on what they personally need clinically or financially. They often are not offered special needs plans as their health conditions change. So what Well Advised does is it customizes and assures that the patient retains his or her preference in the Medicare selection process to keep their preferred hospital and physicians. So clearly, hospitals and providers love that this guarantees the retention of their patients in the system. And then the quick process to get a recommendation aligns with all of these personal preferences. So because a patient can review their choices regularly as their clinical conditions change, those clinical condition changes are then reflected in any new coverage that is selected. So this improves clinical outcomes. It assures appropriate access to care in the most cost-efficient way for a patient. And then, hospitals and providers like introducing their patients to Well Advised because it improves reimbursement by reducing unexpected out-of-pocket costs or unexpected out-of-network charges. Not only does this inure to the benefit of the patient, but it greatly advances financial security for hospitals by reducing bad debt for costs which can't be paid by the patient. This is a win-win for everyone. Hospitals work on a very tight margin. Every percentage of reduction in bad debt enables hospitals to redeploy that money into capital investment or employee benefits. I think that's really cool. And then your question about Why was it not introduced? Well, because the technology was not in place. This is a game changer technology. So Well Advised was developed by a physician and by technology engineers who have already worked in healthcare administration, PHI, and medical records for years. I'm very proud that the technology is so sophisticated that our team is the only team in the United States that has passed the Turing test for artificial intelligence technology, which is the gold standard. That really, I think hospitals love to hear that kind of stuff because it's all about quality outcomes.
Gosh, it sounds like a total win-win, Mimi, and a headline maker in terms of technology and artificial intelligence. It's a fascinating topic. Okay, today we're also joined by a special guest, HASC's Anna Reza. Anna has worked for more than 2 decades finding ways to ease the Medicare and the Medicaid Medi-Cal enrollment process here in Southern California. Anna, maybe you can tell us what the chief hurdles are when a patient faces any new enrollment.
Thank you, Eric. Sure. Access to care, which includes one's ability to pay out-of-pocket deductibles and copays, is important for both patients and hospitals. Research has identified that 1 in 6 Medicare beneficiaries had problems paying their medical bills, which includes prescriptions, doctor visits, and hospitalizations. Consequently, this puts those individuals at greater risk of incurring high medical expenses or foregoing medical care due to cost. And foregoing care due to cost should not happen. So engaging Medicare beneficiaries while in the hospital setting to discuss both clinical and financial coverage needs by inputting details into a tool that provides guidance on Medicare coverage, supports the patient, community, professional healthcare providers, and our hospitals. In our experience, the chief hurdle, especially for our older adult population with Medicare benefits, is getting the patient to openly discuss their financial situation. Once we overcome that barrier, it's a fluid conversation, and I'm excited to have Well Advised as a tool for our hospitals.
Thanks, Anna. Really appreciate that. Okay, now let's take the conversation back to Mimi. Mimi, is there anything else our members should know about Well Advised and what it can do for them and their patients?
Well, one thing I'd like to also share is my firm belief that implementing Well Advised is a critical step in advancing health equity and access to care. It's free to use for all patients. It enables intelligent, non-biased advice to people who otherwise would not have access to get advice. It protects patient confidentiality in that the information on our system is never sold or shared with anyone. Patients never get robocalls or unwanted marketing. I can share that I have recently turned 65, and yes, I am a proud, well-advised consumer. But I started getting hundreds of unsolicited calls, emails, mails, snail mail, everything, and it drove me nuts. And I can attest to the fact that we built this system to be so consumer and patient friendly of what are the things you want to make sure it doesn't do, and we wanted to make sure we never approach people without their permission. So, and it's also an extraordinary resource for all staff who work in patient access, reimbursement, admissions, social work, or discharge planning. I mean, just imagine using a free, easy-to-access resource like Well Advised to improve HCAHPS and patient satisfaction scores, to improve ongoing communication with patients, to improve reimbursement for services provided, and to decrease bad debt. We're really happy to be part of this innovation in patient care and look forward to working with every hospital to implement this in their facilities and their physician offices. So that's really what it's all about, is how do we be advocates and serve the patients that we're privileged to have.
Okay, I think that gives a good summary of what Well Advised is and does, and also a good overview of the enrollment process and its challenges. I want to thank Mimi Roberson of Well Advised for her time today. Thanks very much, Mimi, and take care.